Good afternoon and welcome. My name is Katelyn Jones, and I am the Women, Peace and Security Fellow and ACLS Mellon Public Fellow at the Chicago Council on Global Affairs. Thank you so much for joining us for this afternoon's program, Gender and Humanitarian Dimensions of COVID-19. In the interest of public health and in accordance with CDC guidelines, the Council has made the decision to cancel all in-person public events through at least June 5th. As an institution, we are as committed as ever to being the organization in Chicago that brings you relevant and timely conversations on what's happening in the world and why it matters, even if those conversations have to take place virtually for now. Please check out our website and social media pages for updates, as well as for new podcasts, events, blogs, and research. Thank you to all our members who are tuning in right now. We need your support and engagement more than ever at this time. Please do keep us in mind as you help to keep nonprofits operating in this challenging time. And thank you to our sponsors. This conversation is part of our Women, Equity, and Global Development series. Thank you to our lead sponsors, Abbott and Horizon Therapeutics, and patron sponsors, Holthuis Trust, Ashley and Avery McCall, Susan and Bob Morrison, and the Zakat Foundation of America. As a reminder, the Council is an independent platform, and views expressed by individuals we host are their own and do not represent institutional positions or views of the Council. And now for today's discussion. While the coronavirus pandemic is dramatically affecting people's lives everywhere, it is expected to most significantly impact the 2 billion people living in conflict-affected regions, as well as those in densely populated refugee settlements. Moreover, women, children, and other vulnerable groups in all settings are disproportionately affected. Why is it critical to use a gender-responsive approach to addressing the pandemic? How does it alleviate the unique burdens women and other vulnerable groups bear? And how can these responses help all people? We're going to address these questions over the next 45 minutes. Shortly, we will incorporate your questions, so be sure to turn your browsers to ccga.live to submit a question of your own or vote for questions that you like. And now it is my great pleasure to introduce our speakers today. We have Jocelyn Kelly, who is the founding director of Harvard Humanitarian Initiative's program on gender, rights, and resilience, and is a fellow where she designs and implements projects to examine issues relating to gender, peace, and security in fragile states. Also joining us is Dorri McWhorter. She is the CEO of YWCA Metropolitan Chicago, a social enterprise focused on eliminating racism and empowering women. And finally, we have Ambassador Roya Rahmani. She is the first woman ambassador of Afghanistan to the United States. She's also the designated non-resident ambassador to Argentina, Mexico, the Dominican Republic, and Colombia. She is known for being a powerful advocate for women's rights, democracy promotion, and sustainable peace in Afghanistan. Thank you all for being here and welcome to our conversation. Really looking forward to talking about this with all of you. I think this will be a really great conversation, especially highlighting the kind of connections between gender-informed policy responses at the local and global levels. So to get the conversation started, I'd really love to hear from you all on how are women experiencing the effects of the coronavirus differently from men? And how are women of color affected differently from white women? So we know in the US, for example, there's been tremendous evidence of women of color, women who are parts of indigenous populations experiencing this pandemic very differently. So I'd love to hear from you all kind of more on those gendered dimensions of the pandemic.
Great, thank you, Katelyn, and I'll start us off. It's interesting to have, with this panel, such a wide range of representation compared to local and global, because I don't know that for women of color, particularly given that the majority of the world, quite frankly, is comprised of Black and brown women, but when you think about that specific dimension here in the United States and what we're seeing in Chicago, is that there absolutely is a difference. As we think about the issues that women face, and often the fact of the matter is that women of color experience those issues even more severely. So whether we're talking about on the financial and economic spectrum, recognizing that equal pay here in the U.S. we talk about is definitely something that we see are impacted by. Or the impacts are more severe by race. That's an issue that if you look at the jobs in particular, that when we shut down the economy, those jobs are also impacting the women of color that are in those jobs even more tremendously. So when you talk about every level of disparity, we see that this issue is impacting women of color and having harsher consequences. I know specifically in Chicago, the data has come out that folks that have experienced the coronavirus and have unfortunately passed from that occurrence in Black communities are so much higher. So it's interesting. I know we shouldn't be surprised that if we had disparities and before the virus, clearly the impact of the virus has really exacerbated every single disparity that we've seen across a broad spectrum.
So just to build on Dorri's point, I think it's so important when you think about a crisis situation or, here in the US, that anytime you have a problem like this, it's really layered upon all of the existing fault lines of inequity, poverty, and injustice that were already existing in any given situation. We also know that across the globe, an estimated 60 to 80% of caregiving is done by women. So women often carry the burden not only of household chores, provision of food, childcare, homeschooling, but they're also caring for those who are elderly or those who are ill, including those ill from COVID. So many of the effects of COVID that we see, especially the social effects, fall squarely on the shoulders of women. And I think for minority populations, there's often restricted access to healthcare and understandable mistrust of the healthcare systems that have often let them down in the past. And so all of that can really affect healthcare seeking and outcomes. We also see in some of the very poorest settings where the Harvard Humanitarian Initiative works that women are the first in the household to take on the burden that falls on the family. So they'll start limiting food, start trying to work harder, and that the practices that they undertake can unfortunately have long-term negative impacts, not only for the women themselves, but for girl children who often carry those burdens as well. I also wanted to note, since we're talking about the gendered impacts, there is some evidence that men may be biologically more at risk of contracting and dying from COVID, but we also know that care-seeking behaviors are different from men and women, and so that, reminds us that there are behavioral layers upon biological layers when we look at something like this. So I just want to note that this might be a really unique chance in the world to try to respond in a gender-sensitive way to one of the grandest pandemics that we've all faced, and that it highlights the importance of using a gendered lens to understand these risk factors.
Thank you for organizing this panel, and it's great to be with wonderful fellows in this panel. I also would like to echo what the other panelists said. The women are going to be suffering a lot more because they always do in the situation of crisis. The magnitude of the impact on women is always multiplied, whether it is a situation of conflict like the one that we are experiencing back at home in Afghanistan, or and it is being exacerbated by the pandemic and vice versa. So they are both pushing one another forward, and the impact on women is greater in multiple ways. In the ways that was already discussed, whether it is losing their jobs, because most women, and we know now over 70% of women globally are engaged in informal labor rather than the formal. So they are the first to lose their job. They have the least of the savings, and they are the one that also are engaged in care for the family, as was mentioned, which is obviously unpaid work. So they earn less, they save less, and they are the first ones to be laid off. So that's the first effect economically, as they are husbands and partners or whoever is losing the job in the household. Again, that adds an additional burden in how they are carrying out and the relationship, and then exposes them even for additional violence within the household. In addition to that, the burden of caregiving has been magnified because all the children are out of school. So the women right away have an additional job to do in addition to everything that they have been doing before. Again, in the health sector, as Jocelyn was talking about the behaviors, but then also as there is data that's showing that men are more susceptible to the virus, there is tendencies of moving funds, including funds that are specifically for reproductive issues, and concentration of the attention to combat COVID-19. So women are at loss in so many different ways and are impacted a lot more than men are in every place. And in situation of conflict where movement is already restricted, where access is restricted, where they are already facing a huge range of challenges, this gets the impact of this gets multiplied. And I again echo what was being said here, that this is once again signaling, and it is the time to consider these issues, to consider the importance of the fair pay, equal pay, maternity leave, sick leave, and incorporate more gender-sensitive policies and think about them, because as they are affected more, at the same time, they are the one that will be playing the most important role for recovery as well.
Yeah. Thank you all for your thoughts, especially acknowledging, as you also clearly laid out, that the issue of the pandemic is exacerbating pre-existing problems, whether it be healthcare availability, or economic stability, and all of these things. And one thing you also all touched on was issues of security and violence. And so I'd like to hear from you all a little bit more on that point. So how has COVID-19 impacted women's safety and security at home? What kinds of consequences are we seeing locally, as well as globally? So Dorri, I'd love to hear from you on kind of what you're seeing in Chicago with respect to safety and security at home for women at this time.
Sure. In Chicago, the YWCA operates the rape crisis lines across the metropolitan area, and surprisingly, our calls have declined. And what we recognize about that, we all know that it hasn't been because all of a sudden the incidences have been reduced. We know that women are not safe, so they cannot call us. We're also not being allowed to respond. Our advocates cannot go into hospitals right now to respond when women do present there. So what we're seeing is that not only do you have the issue of, we know the occurrences are still happening, since most sexual assaults are from folks that they know. So we know that they are in fact still happening, but we know that women are not able to access the appropriate interventions to make sure that they're safe and get the support they need, which really is going to be concerning, I think, and we'll need to take a look at what happens as a result of this. Because of that increased trauma and the impact of that stress and trauma, that's going to show up in our system for a long time. It's not just going to be once we go back to normal, everything is okay. These women will still have to address that trauma. And as our panelists, which I am so grateful for, these amazing panelists have all so beautifully articulated, you now have put another layer of stress and trauma in addition to everything else that my fellow panelists have already described. And that's going to have a longer term impact than I think we can ever really imagine right now. The other piece I want to point out about sort of the stress and trauma and the lack of the ability to deal with that is that I'm also concerned about what other predatory practices are going to happen, as we know that people's resiliency is breaking down right now, and we don't know what that's going to look like either. And as my panelist described earlier, when you have such vulnerable populations and layer on layer of challenges, there's just going to be so many ramifications that we have to deal with. And if we do these in I would say, a more gender-informed way, I absolutely also believe we can overcome them, but we have to start thinking about them now and choosing, quite frankly, not to be ignorant of them.
Mm-hmm. Yeah, thank you, Dorri, especially kind of pointing out the fact that these are questions that we're going to have to continue to address going forward, especially as new kinds of problems and as you said, predatory practices emerge. So Jocelyn, I'd love to hear from you in terms of what sorts of trends and responses you're seeing globally with respect to safety and security.
Yeah, I think that was such a kind of powerful summary from Dorri, and a reminder that even during these difficult times, there are heroic workers, not only in healthcare, but in mental health and rape crisis centers, who are kind of carrying the torch and helping those who are most isolated to make it through this time. So one of the promising things that I think we've seen in this epidemic is that we've seen a lot of recognition of the shadow epidemic of domestic violence globally, including in the US, as was just really poignantly highlighted. And we know that rates of violence against women and violence against children are increasing, while we actually often see reporting go down. And we might see that because COVID exacerbates all of those myriad risk factors that can exacerbate violence within the home, including confinement, social isolation, emotional and financial stress, and weak institutional responses, and a lack of opportunity to kind of seek help outside the home. I was really privileged to actually speak to a lot of women in Italy during the time of isolation there, and particularly women upstanders, just like Dorri, who were running violence centers and help centers. And it was extraordinarily inspiring, because they were taking this as an opportunity to say, look, reporting has gone down, but we know that the problem is still there. And they leverage these incredible tools of social media and websites to produce videos saying, we know that this is happening. You are not alone, and we are here for you. And what we've seen across the globe, including in the US, is these really creative, thoughtful, brave ways that women are finding ways to connect with each other. So that might be saying, we understand you can't make a call because you're cloistered with a perpetrator in your home, and he can hear you making a telephone call. So they set up WhatsApp or Facebook messaging groups that look very innocuous, where you can seek support or report violence. We also are hearing pharmacies in France are allowing women to report abuse using code words, and there are pop-up counseling centers in supermarkets and things like that. So I think this is a moment to kind of recognize the ingenuity and bravery of all of our first responders, acknowledging the shadow pandemic as it comes up at the same time as COVID.
Yeah, and thank you for that, Jocelyn, especially thinking about how those kind of new innovations in reporting are things that, as Dorri suggested, could inform reporting and resources available to women in the future, right, once the pandemic is done. So Ambassador Rahmani, I'd love to hear from you in terms of women's safety and security in Afghanistan at this time.
Thank you. First, let me share this piece of data that globally, so far, we know that since the outbreak of this pandemic, the violence against women globally has approximately, based on reported cases, has increased 25%. Oh. In many occasions, it has been even doubled. So for many reasons that were already discussed before, loss of jobs, economic and emotional stress, the additional burden of caregiving, having sick people at home, and in Afghanistan with the additional aspect of an ongoing conflict, because there is still not a ceasefire, and in many places there is no access to healthcare, and the responders cannot go to the places, to the villages, to the certain places to reach to the people. Forget about to men, to women, to children, to any of them. So that is creating a huge burden on. Excuse me. Yeah, this is also part of this. Sorry. I will talk to you later. Okay, thank you very much. I'm sorry.
Oh, don't apologize at all.
Yes, they get it. You say hi. Sorry, everybody. You see, this is what the new world looks like for women. I wanted to say that in Afghanistan, yes, there is that layer of conflict that impacts women and their access to resources. Also, as the colleagues mentioned, now, because everybody is distracted, paying attention to what COVID is doing, the shelters are not functioning, the hotlines are not operating, and then at the same time there is another level that people right now it's not at the top of the priorities, and that is that how much trauma and stress it can cause within the household. Those women that now are living and in close proximity with their abusers. And then what would be the long-term impact of it? So it has a very, it goes like a vicious cycle, because one impacts another and exacerbates one another impact, because my concern is that as we are going through, because of the very prominent level of poverty and conflict that still is ongoing, still exists in Afghanistan, the impact of it in the long term would be greater. The women who are being abused and are abused mothers in the future, that has a security impact for my country, for the region, and globally.
Yeah. Thank you for that, Ambassador Rahmani. Really helpful to think about these consequences, as you said, specifically in a conflict setting, and also your daughter coming into this meeting, I think, beautifully highlighted, right, the burden of care, especially for women at this time. So all of you have alluded to the economic consequences and the burden of unpaid labor on women at this time. I'd really like to hear a little more from Dorri now, thinking about in the context of Chicago. So how have we seen, and you've seen in Chicago in your work, the burdens of unpaid work shifting for women, and what policy responses do we need, in Chicago in particular, and even more broadly, to address the augmentation of, as we know, these pre-existing burdens and inequities for women?
Sure. I think that Ambassador Rahmani spoke about this earlier too, in terms of just the high level of participation of women in the informal economy. And what we're seeing is that women doing unpaid work, particularly around childcare and other domestic services, which always is so striking to me. While we're doing unpaid work, we're still adding so much value to the economy and everything that we're doing. We're just not receiving that value, right? And so I think that, just like everything, to some degree, I feel like a broken record. Of course, it's exacerbated because even as was demonstrated by our beautiful little visitor that we had, that there is so much caregiving even necessary, given that schools are closed. So to the degree that women were already doing this unpaid work, now the volume of that has increased. And what we're also concerned about in Chicago too, is that if we're not focused on how do we support childcare providers, that now those folks are clearly paid, that we're going to see sort of a decimation of an entire industry that we need to support women to go to work. And so just the broad scope, I think, of this pandemic, if we don't think about it from a gender perspective and understand all the ways that women participate in the economy, whether seen or unseen, we have to still address it. So it gives, some conversation around minimum economic levels and payments that we may need to think about from a society perspective as well, because we know that this unpaid labor is there. So what are sort of the basic income supports that we may need to start thinking about from a society perspective as well? So again, I just think it's like layer after layer. Of course, it's complicated, but it's not impossible. It just takes thinking about it and being informed and recognizing that it's there, and think about then what policies do we need to specifically address it. And I have to say, even though as we all, not only in the United States, but the state of politics around the world continues to be in flux, but what was remarkable is that we saw such quick action from our legislators and getting some response to stimulus. I'm like, if they could do that in 4 days, what else can we do? And so I think that it really will require us to continue to think about how do we address things and address them quickly, so that we can not watch the decimation of an entire group of people as this pandemic continues.
Yeah, thank you, Dorri. It is interesting to think about how such quick responses can happen for certain things, right? So now we know it's possible, and hopefully that'll help get more done in the future. So I'd like to move to Jocelyn now to hear a little bit more about your work and especially what you're hearing from people in your network who you're communicating with. So as the virus, especially in the past week or two, has continued to spread to countries in the global south, what kinds of gendered effects can we anticipate in those areas? What are the additional challenges of addressing COVID-19 in those settings and in conflict settings, as Ambassador Rahmani was speaking about before, and also kind of what policy responses are needed in light of those challenges?
Yeah, thank you so much. So I'm privileged to work as a public health researcher and human rights advocate in a lot of conflict zones around the world, and have been really fortunate to stay deeply connected with all of our incredible collaborators and colleagues in many places in Africa and Latin America. As a reminder to the folks joining us today, there are over 126 million people in need of humanitarian assistance across the globe. And of the 185 countries reporting COVID, 79 of those are refugee hosting countries. So as we've talked about a lot today, as with any crisis, we see that the same issue or the same disease can have very different effects on different populations. And with any health problem, we see that COVID highlights and exacerbates all of those existing inequalities. And nowhere is this going to be more clear than for refugee populations and for those living in conflict-affected countries. You know, what we're hearing from our local collaborators is that many places in the midst of armed conflict have seen substantial damage to their healthcare infrastructure. And so the capacity to detect, test, and treat cases of COVID is nearly non-existent. Refugee settings in particular are characterized by this extreme crowding, and often access to sanitation services like hand washing, which is what we're advocating for really actively, is limited or almost non-existent. And a reminder here, it's important to remember that many refugees and many displaced and vulnerable populations don't even live in formal refugee camps, but they actually live in informal settlements like favelas or super slums like we see outside of Nairobi. And they face those same issues, but sometimes even outside of the purview of international attention. So as a public health person, you know, and as everyone on the call knows, one of the most important dimensions of infectious disease is actually human behavior change. So in fragile states, the governments are often not seen as reliable or trustworthy brokers of information. And we've seen a huge amount of confusion from the colleagues that we talk to in places like DRC or Central African Republic, that they really struggle to get accurate and timely information about COVID. And what you see in those settings is that misinformation and rumors can spread like wildfire. Those lead to really poor health outcomes, but also to very tragic stigmatization and finger pointing against those suspected of having COVID. And even more sadly, you know, that often goes is directed specifically against healthcare providers who are kind of on the front lines of that fight. So in the Ebola responses in Africa, we saw that poor communication and ineffective trust building led to these horrific and severe attacks against healthcare workers. And it should never, ever be the case that those putting themselves and their lives on the line in a healthcare capacity also have to face the risk of personal violence. And so this is an opportunity, I think, for the global community to come together and say, let's get that accurate, timely information to the folks that need it. Let's walk side by side with the partners who have been such incredible, steadfast collaborators of ours, and we're no longer able to meet in person, but this is a moment to kind of leverage technology in places that might not be as used to leveraging technology to get the right information to the right places. And I think most importantly, and I'd love to hear Ambassador Rahmani speak to this, I think this is a time to acknowledge and celebrate and empower all of the local peace builders and the local champions who are there building trust, building peace in their communities, to take this fight forward in their daily activities that are often unrecognized.
Yeah, thank you for that, Jocelyn. It is interesting to think about, you know, increasing marginalization that certain people are experiencing at this time, especially in, as you said, fragile fragile states. But it's also a time to think about how can we empower people working in these contexts to cultivate a more stable and peaceful kind of environment for everyone, even amidst the pandemic. So kind of building on that, I'd like to move to Ambassador Rahmani to hear about kind of the unique challenges facing Afghanistan during this pandemic, especially the unique vulnerabilities that women are facing. And I'd also love to hear you talk a little bit about how the Times3 campaign is kind of working to support these populations and empower them, kind of as Jocelyn was mentioning. So I'll turn it over to you, Ambassador Rahmani.
Thank you for the question. About the unique challenges that Afghanistan faces, I would like to start by saying that all the problems that we have had has not gone away. And then there is this added layer to it. So at the top of everything is insecurity that is inflicted due to this ongoing conflict. Taliban are one of the groups that still have not agreed to a ceasefire. So there is an active conflict going on face of this. Today I heard a piece of news that somebody was killed, that people were not attempting to go closer to the deceased because they were not sure whether and were kind of afraid maybe this person has been also infected with the coronavirus. So this is the magnitude of the problem, especially in the situation of the conflict. On top of that, we have an inflow of the refugees. There is millions of and hundreds of thousands of Afghan refugees living both in Iran and Pakistan, and during this pandemic they have been migrating back. There has been over tens of thousands days migrating back from coming back to Afghanistan from Iran, crossing the border without having all the necessary resources to test them, to quarantine them, because of the huge numbers that are flowing into the country, which of course, as they're traveling and those who are infected, they are spreading the disease. Poverty, of course, is another huge problem. Over 50% of our population are living under poverty lines. What that means is that most of them are relying on day wages in order to make sure that they have food on the table in the evening. And the impact of that is going to be very long term. So in immediate term, they don't have food. In the long term, this could translate in so many different other ways, including violence and insecurity and violent extremism. Another challenge that we have been faced with is the urgency and the pressure being asserted to move on. We already were going through so many transitions in terms of to meet the political deadlines and in order to move things forward. Whether it is through the peace process and also our agendas on how fast we can get, which is of course our very prominent desire to become more economically self-reliant. But all of these forces and pushes coming at the same time, where this other layer of pandemic is really being added, is really, really difficult tasks. And of course, for all those reasons, women are even more susceptible to violence, to lack of access to food, healthcare, resources, additional burden of care, lack of mobility, especially in the areas that there is still an active conflict going on. So it's really magnified in so many ways. And there is also lack of access to the necessary resources to combat COVID-19, whether because in Afghanistan, social distancing is so hard because of the poverty. A lot of people has to continuously rely on, there is many organizations that are trying to provide soaps and masks and gloves, so that at least people are more protected as they are going about their daily businesses. But then there is shortage of shortage of supplies for the hospitals, given again the magnitude of the problem and how it spreads and moves between the countries in the region. Looking at the magnitude of the problem, and to be honest, what makes me personally lose sleep at night is the level of poverty. I keep thinking about the families who cannot feed their children, and I hear their voices every day through the news that I'm coming out, I'm looking for a job, I'm waiting here as a laborer, nobody is hiring me. I go home, I have a hungry family to feed. What do I do? So it of course would contribute to additional level of crimes, violence and whatnot in immediate term and long term with the trauma that people are facing. So as a result of that, we have initiated the ×3 campaign, which basically the purpose of it is first and foremost is that at the face of this global pandemic, all countries are absorbed to their own problems, and rightly so. So we all as citizens need to take responsibility and take charge and do what we need to do. And in the face of problems as such, nothing works better than care and empathy. So if the ×3 campaign's call is that every family that can afford to spare $100 or more, minimum is $100, and it's based on the calculation of minimum wage in Afghanistan, to support a family for a month with $100 or more, then they can sponsor one family and then convince 3 other people, then that's why where ×3 comes from, to do the same thing. So each individual again sponsor another family, each of the 3, and try to convince other 3 to support additional 3 families. And the call was specifically made on Afghans, whether they live within the country or abroad as diaspora, to spare, take charge, and share, build relationship with the families that are most vulnerable and mostly in need, to lift them up, because this is the time that, as much as we are grateful for the support that we continuously have been receiving, and we are receiving during the pandemic too, but we need to also do our part and share. So in 15 steps, this campaign would reach 15 million people. So that's our plea, to just take charge and sponsor families when we can. There is a good number of people who can spare $100, and that would rescue one family from misery, from going hungry at night. So that's the purpose of the campaign, and we are hoping that we will have a lot of people join in. And the purpose of it is just care and empathy and taking charge for a prosperous society.
Thank you, Ambassador Rahmani. I think it's especially helpful to hear, of course, about the unique challenges that Afghanistan is facing right now, especially in the middle of its peace process, but also about the ×3 campaign. And really, it's something that everybody can participate in, right, to support fellow Afghani people at this moment in time. So I'm going to shift now. That actually ties into one of the questions that we received from our audience members. So we had a few people ask about what's something that the general public can do right now to support people that are parts of these vulnerable groups. So I know we heard about the ×3 campaign from Ambassador Rahmani as one potential avenue. I wonder if Jocelyn and Dorri, if you have thoughts on things that kind of people in our audience, general public, might be able to do to support the most vulnerable at this time.
Yeah, and I think what better kind of exhibition of how much care and empathy is happening right now in the world than to have that be the first question from the audience. I think it's so powerful and so touching. I would say, you know, there's extraordinary NGOs that do phenomenal jobs of really empowering and working with local populations who are, after all, the experts in their own issues, and they're experts in how So I certainly encourage you to look at UN agencies. UNHCR is doing a lot of work with more formalized refugee populations. The International Rescue Committee is an extraordinary NGO that we've had the privilege of working with, and I really respect how much they listen to and work with local populations who are affected by the conflict. And I think this is also a moment for all of us to think about how locally we can really sit in our own communities and do the best job that we can to be good neighbors and family members and friends and caregivers in this moment. So those are some thoughts I have on the international scale. And I know, Dorri, you do incredible work in Chicago. So I'd love to hear your thoughts as well.
Sure, thank you. I think ditto to everything Jocelyn said, and again, Ambassador Rahmani, what you all are doing, I think is really important as well, because the fact of the matter is people need direct support and resources right now. So I know in Chicago locally, there's a number of campaigns that are combining resources to do a broad COVID response across Chicago. We have already, as the YWCA, been a recipient of some of those funds, and our goal is to get those funds directly into the hands of community members so that we could help pay rent, help buy diapers, utility, all of the basic needs that people are needing. As well as I also think it's important that we need to continue to think about how we engage politically. And ensuring that we, yes, do the census that's going on in the U.S. right now. We have to continue to do that, because as we look at how we come on the other side of this, allocation of resources are going to matter. So it's also, yes, it's helping your neighbor, but it's also really understanding and getting engaged in the civic process. We all have mentioned how many of these disparities occurred before COVID, and I think the fact that these disparities should also be considered a crisis. It's something that we can support at the local level to make sure that our legislators, our elected officials, our politicians are paying attention to these issues, because when you do have this type of crisis happening, of course, as we've all mentioned, those things increase. So I say, support your local organizations and international organizations that we heard, as well as continue to stay civically involved, because it matters.
Yes, I think there's, Jocelyn was clapping. I don't know, I think there's applause all around from everybody on that front. Staying involved politically, very important. So thank you, Jocelyn and Dorri, for those reflections. So I know we have about 2 minutes left. So I'm going to shift, and I'd like to hear briefly from each of you a response to the question: what do you think is a key lesson that we should all learn from what's happening right now, especially from a gendered perspective? So what, like, one key lesson do you think people can learn from what's happening right now and take away as they think about how to be engaged politically and how to care and empathize with the people around them? So just kind of briefly, I guess we could start off with the order we've been doing. So maybe Dorri, if you want to start off, then we'll go to Jocelyn and Ambassador Rahmani.
Sure. I think the lesson learned, and not to repeat everything I just said, but I do think that the lesson learned is that we do need to pay attention to these issues now. And from a gender perspective, we've been all beating the same drum around what's wrong and what has happened from a gender disparity perspective. We need to address these issues, because now is the time. We have to rebuild. We need to build in a gender-informed way.
Yeah, I love that. I think this is, times of crisis can also be times of transformation. And in some ways, this is one of the most global and universal experiences that we're all feeling. And granted, it's in different ways, but this is probably the closest thing to a universal experience I could think of off the top of my head. And this is a moment to remember how we're all connected, how we can all empathize and care and listen a bit more, and how we can take what I think is the world's first chance to do a truly gender-sensitive approach to response and carry that forward all in our own ways.
And Ambassador Rahmani, your key lesson?
Sure. If I have 3 words, I would say, number one is that we should recognize how uncertain everything is, and things are changing faster than we possibly have been able to imagine it. So therefore, we do not have 100 years to wait for the gender equality to materialize. This is the prediction based on all the data being gathered. So 100 years. We do not have 100 years to wait for gender equality to materialize. Number two is the issue of care and how women should be incorporated in all levels in a way that and that's meaningful, because other than that, the idea of robustness would not be there. We need not only efficient systems, we need robust systems. And women are very good in making sure that that would happen. And number three is that our dependency, as we are so apart right now, and this is what we are experiencing, but it should also bring about that message that we are still very much dependent on one another, and we must act and make policies based on that.
Yeah. Yes, thank you all for your reflections. I think they beautifully captured kind of how urgent the current situation is, but also how through our interconnectedness, we can really make transformative change through all of the avenues that you touched on. I am so grateful for this conversation. I know I learned so much from all of you, so I want to extend a special thank you to Dorri, to Jocelyn, and to Ambassador Rahmani for being here. And I know I speak on behalf of not only myself, but also the council and everybody in our audience today, as well as people who would be watching this later at other times. So thank you all. And also a thank you to our audience, everybody who's been a part of this conversation remotely. Thank you for participation. As a quick reminder, this recording will be made available via CCGA social media. So I encourage people to share, also come back to this conversation as we can continue to think about kind of the gendered dimensions of everything that's happening. And again, thank you all. I wish everyone a good day, and thank you for this wonderful conversation.